My name is Ashley Bailey, and I'm an MS student at Liberty University, and today I'm going to be doing a head-to-toe assessment. Before we get started, I'm going to go ahead and wash my hands. My patient today is Miss Regina Mark. Miss Mark, can you give us your first and last name and your date of birth?
Regina Mark, December 23rd, 1982.
All right, and do you know where you are?
I'm at Fort Community Hospital.
And do you know what we're getting ready to do?
Head-to-toe assessment.
All right, so Miss Mark is alert and oriented. She knows what's going on. Just by doing a general survey of the patient, she does not appear to be in any distress. Her speech was not slurred. So, Miss Mark, I'm going to go ahead and get ready to start your assessment. Before I go ahead and start with her head, I just want to point out some things about her skin from looking at her. So if you look at her upper extremities, just examine your skin. I don't see any lesions on her upper extremities. She has very elastic skin, so she has good skin turgor. Let's check your capillary refill. All right, and her capillary refill is brisk. It's less than 2 seconds. All right, and it's warm. Her skin is warm and dry. All right, now I'm going to go ahead and start working my way from up to down. I'm just looking at your head right now, and I'm making sure that everything is symmetrical. So your head looks symmetrical. I'm also inspecting to make sure that you do not have any dandruff, lice, any lesions, any masses. Her hair is evenly distributed. It's like medium coarse in texture. All right, I'm going to go ahead and start palpating. Do you feel any pain?
No.
And while I'm palpating, I'm also feeling to make sure that I don't feel any masses. So her head is symmetrical, it's normocephalic. Now I'm going to go ahead and I'm just looking at your face. So I'm assessing for symmetry. So right now we're going to assess for 2 important cranial nerves. Cranial nerve number 5, which is the trigeminal, and cranial nerve number 7. Cranial nerve number 5, I'm going to have Regina open and close her mouth. All right, and what I'm listening for is any clicks. I don't hear any. I'm going to assess. Open up again, close, and slide your cheeks back to back, your jaw. All right, one more time. And back to back, your jaw. You feel any pain? All right. Now I'm going to go ahead and assess cranial nerve number 7, which is the facial. And what we're looking for is any asymmetry. Miss Regina, I'm going to have you do a couple of things. So first, I want you to blink. I want you to smile, frown, puff out your cheeks, and purse your lips. When she was doing that, I didn't see any asymmetry. Everything is symmetrical. All right, so next we're going to go ahead and we're going to do your eye assessment. Right now we're assessing cranial nerve 3, 4, and 6. That's the ocular motor, the trochlear, and the abducens. All right, so I'm going to hit the lights. Great. And right now I have my pen light. And the first thing I'm going to do is, Miss Regina, I want you to just focus on something behind me. So find an object to look at, and I'm going to shine this light in your eye. What I'm looking for is a cornea light reflex. All right, so what I seen when I did that is that the light reflection appeared in the corner of her cornea. So that's what it's supposed to do. All right, next, Miss Regina, I'm going to do the 6 cardinal fields of gaze. So I want you to look at this pin light, and I want you to follow it, okay? You ready?
X-ray.
All right. Miss Regina was able to do that without any difficulty. Next, we're going to go ahead and do a test. It's called cover and uncover. What I want you to do is cover one eye, and then I'll tell you when you can let it go. So you can go ahead and start with your left side and cover it. And I want you to focus on something. All right. You can let it go and do the other one. You can let it go. All right, what we were looking for there was any misalignment. I did not see any misalignment. Next, we're gonna go ahead and pull out our ophthalmoscope. All right. I want you to go ahead and focus on something in the back. What I'm looking for here is a red reflex. I was able to see a red reflex. So with the red reflex, patients that do not have it, it could be three things. They could have a cataract, they could have retinoblastoma, or they can have an artificial eye. We didn't have to worry about any of that with Miss Regina because she had a red reflex. All right, I'm going to look in your eye again. All right. What I'm looking for here is her optic disc. The optic disc appears a little bit bright orange pinkish color, and I can see that. I'm also looking for her macula. And inside her macula, she has the fovea centra, which the fovea centra is responsible for making sure that you see sharpness. And the macula is responsible for your central vision. I'm also going to look on the other side. All right. Other really important things that are seen in the eye is the arterial walls. So arterial walls are supposed to be transparent. Patients that have hypertension, they may appear like narrowed. Patients that have high triglycerides, they may appear milky white. All right, so I'm done with that right now. I'm going to turn the light back on. And Miss Regina, I'm going to test your peripheral vision. So what I'm going to do is I'm going to use my fingers and hold up numbers on the side. And I want you to tell me what that number is, okay? So I'm going to get started.
3, 4.
So I was testing her peripheral vision. She got one of them right. Other things that you can do for vision is the acuity test. So you have the Snellen. For the Snellen chart, we usually have patients stand 20 feet away from a whiteboard with numbers on them and letters, and they have to be able to read the smallest print size. Another test that you can do for visual acuity, but it's for near acuity, is the Rosenbaum test. And with this test, we have patients look at a sheet that's 14 inches in front of them. The highest score you can make for that is a 14 out of 14 in each eye. All right, so we are done with your eye assessment. Next, we're going to move on to your ears. So what I'm doing right now is I'm just looking at her ears, making sure that they're the same in size, and they are. The skin complexion matches, the same as her face. I'm looking at the auricles. I don't see any masses or lesions. All right, I'm just going to go ahead and palpate here. I'm palpating her auricle and her mastoid. I'm going to do the same thing on this one. Do you feel any pain when I do that? All right, good. Now we're going to go ahead and do some hearing tests with Miss Regina. The first one that I'm going to do is the whisper test. So what I want you to do is to cover this ear, and I'm going to whisper something, and I want you, if you can hear it, to repeat it.
I'll grab them. Okay.
All right, she heard it. Now I want you to do it on the other side.
I think we were all getting angry. We need to express a friend so we can move.
Stop.
She heard that as well. The next test that we're going to do for hearing is the Weber test. And with that test, we use our tuning fork. I'm going to go ahead and I'm going to hit this tuning fork and make it vibrate, and I'm going to place it in the middle of your head. What I want you to do is let me know if you feel the vibration or you hear the vibration particularly louder in one ear than the other, or is it both the same for you? Okay? Alright. Now I'm going to take the tuning fork and I'm going to go ahead and I'm going to hit it and I'm going to place it on your mastoid. When the vibration stops, let me know.
It's getting there. Okay, stop.
Good. She was able to recognize it when the vibration stopped. Now I'm going to hit it. I'm going to place it right above your ear. Let me know when you hear it stop. Good. Let me do the other side. Right. So what I noted there was that air conduction was greater than bone conduction, and that is a normal response. So you passed there. Now I'm going to go ahead and I'm looking your ears with the otoscope. Can I have you just tilt a little bit for me this way? Thank you. What I'm looking for is her tympanic membrane. And I'm able to see that it's a lightish gray color. That's a normal finding. I see a little bit of cerumen, which is normal. I don't see any fluid in the ear or any swelling. All right, let's look on the other side. All right, I can see her tympanic membrane in this ear. And it's a little gray in color, which is how it's supposed to be. A little bit of cerumen. I don't see any fluid. All right, your ears look good.
Thank you.
All right, next, Miss Regina, I'm going to go ahead and I'm going to look at your nose, okay? So right now I'm just looking at her nose externally. It is symmetrical in her face. I don't see any masses. I'm just going to feel any pain here. All right. I want you to tilt your head up. I'm going to look inside your nose. Okay, what I'm looking at is her septum, her turbinate. I'm making sure that she doesn't have any polyps in her nose or any swelling or any drainage. Just tilt your head up for me. Oh. The other side, I don't see any polyps or drainage. And no swelling. All right. Now I'm going to go ahead and I'm going to assess your olfactory. Okay, that's cranial nerve number 1. But I want you to just close your eyes. I'm going to have you smell something and I want you to tell me what it is. Yes, it's cinnamon. You can open your eyes. She had no problem recognizing that that was cinnamon. Next, we're going to go ahead and test cranial nerve number 9, 10, and 12. Cranial nerve number 9 is the glossopharyngeal. Cranial nerve number 10 is the vagus, and cranial nerve number 12 is the hypoglossal. For cranial nerve number 9, I'm going to have you open your mouth. I'm going to get this tongue laid out, and I want you to say ah. Open up. Say ah.
Ah.
One more time.
Ah.
Okay. And what I was looking for is her soft palate and her uvula to rise when they said ah at the midline, and they did. I'm going to have you open up again. Right now, can you stick your tongue out a little bit? I'm inspecting her mouth. I don't see any lesions. Her mucosa is pink and moist. Can you put your tongue up to your roof? All right. I can see her salivary ducts. She has good dentition.